Hey everyone, welcome back to the Meta-Analysis Academy. In today's video, we're going to talk about challenges by international medical graduates in matching and also in doing residency in the United States. We're going to discuss everything from the match process itself to navigating visa hurdles and the long hours of doing residency training in the US. So let's dive in and explore these issues as they apply to international medical graduates. If you're new to this channel, I'm an international medical graduate myself. My name is Rhanderson Cardoso. I graduated medical school in Brazil in 2012 and then came to the United States for residency, where I matched into internal medicine at the University of Miami. I was a chief resident there. Then I did cardiology fellowship at the Johns Hopkins Hospital, and now I am a cardiac imaging attending at Harvard Medical School. It is important for you to understand that the Meta-Analysis Academy is not affiliated with these institutions. The opinions here are my own. All right, let's get right into it. What are the challenges for IMGs as they apply and do residency in the United States? First, let's start off by talking about the match. Obviously, everyone knows that it's very competitive. You also know that there's a lower match rate in international medical graduates among IMGs compared with United States graduates, but I want you to go a little bit beyond that. I'm going to talk about the different components of the application and how they may be more challenging for international medical graduates. So at pretty much every single component, we start off one step behind the US graduates. So for example, our medical schools may not be as well recognized in the academic community as their own medical schools. So when residency programs look at your application, they really can't know the quality of training that you've had in your own medical school in your country. So they're just out in the dark. It may have been a great medical school, but there's usually no way for them to know that specifically. So we're one step behind in terms of the medical school where we graduated. In the other components as well. For example, research opportunities will be more available in the United States compared to international community. The preparation for the USMLEs, the United States Medical Licensing Examination. The American graduates, of course, they have a specific dedicated curriculum to do well on these exams, whereas we IMGs have to figure out our own way into studying and preparing for these exams. It may not be built into our training, into our medical school education, the preparation for the USMLE steps 1 and 2. Now, having said all of this, I want to also point out that despite these challenges, the process to apply for residency in the United States for IMGs is very clear. That is an amazing advantage of the United States compared with other countries, where the process is very well defined. Everyone knows what you have to do well, to get into maybe even a competitive specialty. So the fact that the rules are clear makes it a little bit easier for us because, for example, in terms of preparing for the steps, you know what the tests are going to be like, you can really study well the question banks, you can do whatever it takes to get a really high score. Same thing with publications, you know that they're really important. So you may do a research fellow, or you may learn how to do systematic reviews and meta-analysis and publish well, because again, you know what the rules are, you know what the programs are looking for, so you can just work really hard to overcome these barriers, and even as an IMG, to get a good residency match, like I did and so many others. So in summary, you need to be persistent, you need to be resilient, but you need to plan well each step. Just figure out what you're going to apply to, how you're going to prepare for the steps, for publications, for your rotations. Make sure you allocate your time, your resources, so you can be very effective in your strategy to win the game. Now, it's obvious that residents work long hours no matter where they are in the world. Whatever country it may be, the residency is going to be tough. It's going to demand a lot from you. But in some countries, for example, residency hours may be capped at 60 hours. In the United States, it's actually 80. So ACGME, the institution that oversees residency training and sets the rules, will allow up to 80 hours of work during the week in residency training. So it can be really really tough, it can be really busy, and that puts a demand on you, especially as an IMG, where you're away from home, away from your family, sometimes alone in the United States, new culture, new barriers, and you're still working a lot of hours per week. So that demand is an extra challenge that we face as residents. But there's also the positive side of this. In many countries around the world, the salary that you get paid in residency is not enough for you to maintain yourself. You need to work beyond residency. It's like that in Brazil, where I'm from, for example. Even though you may not work as hard in residency, you need to work extra shifts outside residency just to pay rent. But in the United States, generally speaking, you will make enough money as a resident to sustain, to maintain yourself and your family. Again, probably at the expense of very long hours. So with this in mind, make sure to take good care of yourself, sleep well as much as you can, try to get exercise, plan your meals accordingly so that your lifestyle, your healthy habits don't fall through the cracks as you're working up to 80 hours a week as a resident. Now we're going to talk about visas for residency training in the United States, and this is a long topic. We're going to prepare a future video discussing these issues in more detail. But let's discuss in general terms about the J1 and H1 visa as you apply for residency in the United States. The J1 is the most common type of visa that residents do their training with. It's a great visa for you to train in the sense that there's very little paperwork that your program needs to do to get you a J visa. The ECFMG, the Educational Commission for Foreign Medical Graduates, the same institution that applies the USMLE for international medical graduates, ECFMG will take care of the J1 visa. So the paperwork is limited for programs, it's very straightforward, and it is the most common visa by which international doctors do their training in the United States. So what is the problem for the J1 visa? It is that after you're done with training, there is a requirement for you to go home to your home country for 2 years. This is called a 2-year home requirement. This is done at the end of your training, so you can do all your training first, and then you go back home for 2 years. If you do not want to go home at the end of your training for 2 years, you can apply for a waiver of this 2-year home requirement. There are specific situations, scenarios on how you could do this. We're going to talk about those in a different video. Now, there's a disclaimer here that I am not an attorney, I am not an immigration lawyer. I am just speaking here about my general knowledge about the J1 visa and the H1 visa. So the alternative is the H1 visa. Now, this is a good visa in the sense that you don't need to do that 2-year home requirement later on. The H1 visa is a visa with immigration intent. So you already, when you apply for an H visa, you already signal that you may want to stay in the United States, and you don't necessarily have to go back to your home country after you're done with training. Now, what is the problem then with the H visa? Well, there are a few particularities that you should be aware of. Number one, you need to already have finished Step 3, United States Medical Licensing Examination Step 3, to apply for an H visa as a doctor, as a physician. So in my case, for example, I finished medical school and immediately applied to residency. I didn't have Step 3 yet when I matched, so I couldn't do the H visa. I did the J visa instead. But the H visa also has another setback, which is the fact that it's extra work for the residency programs. It's more paperwork. They have to initiate the petition. It's not the ECFMG, it's the residency program. So not a lot of programs, or fewer programs, offer the possibility of doing your residency training under an H. That may be a problem when you apply for fellowship, because the pool for fellowship programs tends to be more limited, and then you may have some programs that say, you know what, we're just not going to sponsor an H1 visa. We're going to preferentially take J1 visa holders for our position. But you shouldn't be too worried about this. If you train under an H visa, overall it's a better visa, just because again you don't have to deal with that 2-year home requirement later on. Of course, this assumes that your intent is to stay in the United States after training. Another key difference between those two visas is that the J visa does not allow moonlighting. So extra income, doing extra shift beyond your residency work, whereas the H visa will potentially allow for that. Now, you do also need to check with your residency program whether it is okay, acceptable according to their policy for you to do these extra shifts, these moonlighting shifts. But again, you have to check with your residency program about this. You could potentially do it under an H, but not under a J visa. And finally, we're going to talk about cultural differences in the United States versus our home countries. One final important issue to discuss relative to training in the United States for international medical graduates is cultural difference. Obviously, there are multiple aspects that involve the life of being a doctor in the United States beyond the medical training itself or surgical training. So I'll give you one very practical example of this. In Brazil, where I'm from, patients see doctors in a different way in the sense of authority and respect, and shared decision making is much less common where I'm from as compared with the United States. In the United States, especially in urban, major metro areas, it is very common for decisions to be taken in collaboration between doctors and patients, where options are shared with the patients and risks and benefits. And in Brazil, even as we try to do that as physicians, patients tend to prefer a more direct approach where essentially the doctor strongly recommends one option. Obviously, there are situations in medicine where even in the United States, doctors will strongly recommend one option. But in general, this is just an example of a cultural difference between patient care in the United States and in Brazil. And there are many others that you will face. So there will be these extra challenges that you will have to navigate as you come into this new culture, not just of the training itself, but how we interact with patients, interact with other healthcare professionals, but you will quickly get this as well. Make sure you fit into the culture of your training program, of the healthcare system as a whole. So in conclusion, pursuing medical training in the United States as an international medical graduate presents a unique set of challenges, from residency matching to visa issues to cultural competence. However, the same determination that you will show to get a position in the United States, the resilience, the dedication, the effort, will make you also an outstanding doctor in America. Some of the best doctors that I've trained under in the United States were IMGs themselves, who've done really well here in academia, and I know for sure that some are doing very well in private practice also. You're not alone in this journey. Your contributions to the care of your patients, to the education of other doctors and medical students around you, these are all very valuable. Keep up the good work, and thanks so much for joining me today. I look forward to seeing you in future videos of the Meta-Analysis Academy. And don't forget, if you want to learn how to do systematic reviews and meta-analysis well to advance your career, make sure to join our program by joining our waitlist. I'll see you next time.